Today I'm with Tech Massage Therapy and Private Personal Training, aka Dr. Jiu Jitsu. Today I have a good friend of mine, a client, who's willing to let me work on him so I can demonstrate a couple of techniques and explain a couple of things for you. One thing I want to point out, I'm going to be working on the quadratus lumborum right here for him. One thing for him is because he sits a lot, and also you used to do jiu-jitsu and wrestle, things like that. Is that correct?
Correct.
So this muscle, the quadratus lumborum, I see it being overactive in a lot of people. And here are a couple of things you guys might want to notice. The quadratus lumborum, it originates down here by the hip. It also attaches to the ribs and to the spine. Now, if you think about it, by the ribs, it helps with inhalation. And when this muscle is tight, it really affects the person's breathing patterns. Also, next to the spine has a lot of nerves that go through the spinal cord. And when this muscle is overactive, it also can pinch on those nerves and cause muscle pain, aches, imbalances, and imbalance of movement. Also, by the hip, there's a lot of muscles that attach and originate here with the glutes, the TFL. They're all connected down here. Having said that, when these muscles are overactive and they have deep trigger points in here, and you also sit a lot, it really does affect your performance, the way you move. When you get upright, you might feel tightness, because also this muscle connects down to the psoas, hip flexor, the iliopsoas complex. In jiu-jitsu athletes especially, because we spend so much time on our back with our knees and elbows in, this muscle is contracted. And also this quadratus lumborum involves side bending a lot. So when we side bend and flex sideways, this muscle becomes overactive. So you can think about going on your side in jiu-jitsu, shrimping, crunching, sitting up. We take a beating with this muscle. Having said that, I'm gonna warm this muscle up. You can start origin to insertion, slowly massage it, warm it up. When the muscle contracts, it usually contracts insertion to origin. For example, when you flex your bicep, it can contract insertion to origin. So I go origin to insertion to try to loosen it up. Some people believe that's a good way. Everyone has their way. This is just my way. So one basic thing, instead of throwing a lot of techniques here, all I'm gonna do is start finding the origin, start feeling the muscle belly going at an oblique angle, moving in slowly, warming the muscle up. I'm using good body mechanics, so the weight is coming from my hips and my legs. I'm trying to shift into each movement. I'm trying to keep my joints stacked and my tailbone down, neutral. You can think about it like in posture, in base. I'm trying to make it come from my legs, and I'm shifting back. You can think also about switching shoulders. You can think about figure eights. If any of these concepts apply to you or relate to you, if you're a massage therapist who's also a jiu-jitsu practitioner, this might resonate. If you're a massage therapist who enjoys maybe ice skating, you can relate to switching the hip movements. If you're a massage therapist who maybe enjoys judo or karate or Muay Thai, you can think about the figure eight movements with the hips when you're switching hips and you're moving your whole body. I'm also trying to use right now this part of my hand, this part right here, so I can really kind of go like this. Again, if you do jiu-jitsu, you can think about making a grip and rotating like this or like this, and this movement moves my whole body together. My shoulders and hips connect. Once I warm it up, I'm gonna start going at an angle, and I'm gonna start moving in with these two knuckles. As I palpate, I try to find somewhere where there's tender. Can you let me know when there's tenderness?
Mm-hmm. Right there.
All right, so once I found it, I don't want to go too fast. I'll find the position, mark it with my eyes, start going back out and in slowly. I don't want to startle the client. I don't want to go into aggressive. I want him to breathe and relax into the muscle. I tell him to do a box breathing, so take a deep breath in for 2 seconds. You can think about a box, 2 seconds in, 2 seconds out, 2 seconds in, 2 seconds out, and you keep that breathing going. I wait for his nervous system kind of release, let go. I can start watching his rib cage lift and lower. When I feel like he's relaxing a little bit more, I start digging my pressure a little deeper. I start isolating that spot a little bit more. I can feel it a little bit more. I use my weight shift and my heels pushing from the ground. I don't want to overdo it, so all of this is relaxed and I'm driving with my hip, but I'm still relaxed here. I don't want to tighten up too much of my arm because then I lose the feeling and connection to his tissue. So just like in judo or Jiu Jitsu, you want to have tight, loose grips, tight grips, loose wrist. But stacked joints. Can you let me know when I find the spot again?
Mm-hmm. Yeah, it's right there.
All right. Is it localized or does it go into anywhere else?
It kind of goes down a little bit.
How far down?
Feels like a few inches.
A few inches. So that lets me know that more of the muscle belly, and it could be going down a little bit into the glutes if it's not completely centered, which is very common because this muscle does connect to other tissues down here as well, and it could affect the glutes and other parts of the back. There's a lot of trigger points, and I don't like to go directly in. I like to go from an angle from out to in, a little bit of an oblique angle. If I'm using my fingers, I'm using stacked joints.
Yeah, it's a good one right there.
When I find one, I kind of get underneath it at an angle. And again, I'm trying to keep this nice and relaxed and drive from the ground. If you can see, I'm driving from my feet. My chest is up. I don't want my head going too far forward. I want to be looking up like I have eyes in the back of my head, almost like you're posturing up out of a triangle choke. I'm using different metaphors for different people. I'm sure different people watching maybe participate in different sports, so maybe these terms can relate to you. You can also use one hand on top of the other like you're making a frame in Jiu Jitsu. And I want to keep everything relaxed, but engage my frames. After I make one round, I want to relax it and strip it back down a little bit. And I can finish with my elbow swiping in. And I don't want to let go of the clients, so I'll come right back, either shift my way back, like so, or I can always make my way back and grab a little bit more of the tissue of the glutes and make a nice connected stroke for the client so it doesn't feel too abrupt or detached. And I'll keep using this concept up all the way down to the rectus spinae, all the rectus spinae muscles. And if he told me that it goes down a little bit more, that lets me know there's probably more trigger points and I can make my connection all the way in this quadrant to the glutes, the piriformis, the TFL, some more of the quadratus lumborum, and probably into the rhomboid major, rhomboid minor, and the traps. Thank you so much for watching. Please share this video, subscribe to our channel to help us grow, and find us on Instagram.